Coming up on NewsNite, we talk with three of the most educated, awarded, innovative guests we have ever had on this program. And what they are doing in the field of healthcare will impact all of our lives. One of them is even a rock star of science. And it's not the one with the dreadlocks. That's next on NewsNite. Welcome to NewsNite and this week's program. And it's a very special program indeed. You know, the Akron-area has long been known for its innovation, its entrepreneurship, and its leadership. And that is very much the case with the Austen BioInnovation Institute of Akron, or ABIA. It has unarguably been recognized as one of the most far-reaching and innovative healthcare-related based education, development, and research models in the world. And joining me to give us a little more insight on ABIA, we want to welcome three of the individuals who are key to its success and to its future. We want to welcome Dr. Frank Douglas, who is in fact the president and CEO of ABIA, Dr. Michael Holder Jr., who is vice president, ABI Center for Simulation and Integrated Healthcare Education, and Bill Considine, President and CEO of Akron Children's Hospital, and he is the current chair of ABIA. Gentlemen, it's a pleasure.
It's a pleasure. Thank you.
Thank you very much for being with us. And I guess the best place to start is, what is Austen BioInnovation Institute of Akron? What is it?
Well, probably I'll take that. Or Bill, would you?
Well, I'll be glad to start, okay. Dr. Douglas. It is a phenomenal collaborative, and it's a way here in our community that we really try to bring innovative minds together. And through the synergy that comes from that collaboration of those innovative minds, look at ways that we can really enhance the economic vitality of the great city of Akron. And it is something that I know I have really enjoyed being part of the journey that has brought private companies together, the three hospitals together, the two universities, and our greater Akron community to do something that, in my mind, is really transformational.
Well, and I do want to ask, is there any other organization that you are aware of like ABIA anywhere?
And here are the areas in which we're unique. One, this is a public-private philanthropic partnership. You will find public-private partnerships. You will find philanthropic private partnerships. It's rare that you have, as Bill mentioned, you have the hospitals, you have the universities, and you also have the Knight Foundation, which is not just a founder and a grantor, but integrally involved in what we do. So it's a public-private partnership. So that's one distinction. The second distinction is that we are patient-centered. Now, many people do that. Many organizations do focus on patients. Mm-hmm. However, we have created a special place. We have created a mock hospital. And in this special place, we bring together, as Bill mentioned, the best minds from our institutions, the best minds and entrepreneurs from our community, into that space to talk about patient problems, to work on solutions for patient problems, to educate, to develop products.
Are you a for-profit company or a non-profit company? Is it a combination of the two?
No, we're a 501c3.
Okay.
However, sustainability is extremely important. Right. So we not only presently exist by grants, etc., but we have developed a number of assets which we have to monetize in order to be sure that we become self-sustainable over the next years. Yes.
How did ABIA come to be located in Akron?
Well, through some conversations here in our community, and as you know, I'm a native Akronite, mm-hmm. and really proud of that. And one of the wonderful traits of our community is the collaborative nature, where we do come together and talk about how we can really get to a higher plateau by working together and get to a place you can never get by yourself. And ABI is an example of that. And when we had the 3 hospitals, Summa Health System, Akron General, Children's, along with the University of Akron, along with the medical school, medical university, we started talking about doing something together that we couldn't do on our own. And that really formed this vision of creating something around bioinnovation here in our town, and focusing in on areas where we had some expertise, polymers and orthopedics. And when we had an idea and put a business plan together around that, we went down and talked to the Knight Foundation. And of course, Jack Knight, native Akronite, the Knight Foundation, this being one of their key communities, they want to invest in their community. They want to invest in the Knight Brothers community. So we shared this new idea with them. They liked it. They put $20 million on the table over about a 5, 6, 7-year period of time. The hospital community and the universities matched that. We went out to the business community and were able to get some other dollars to the table. And we've been talking to other foundations about joining us. And with that kind of momentum, we're all about now creating some special magic in this town around new jobs in the bioinnovation arena. So it's been about a 5-year journey, but it's one that has taught us all some wonderful life lessons and created a bond that, as Dr. Douglas said, I don't think is to be replicated anywhere in this country right now.
Well, and you're right, because not too long ago we had Dan Rice and Chris Burnham on the program, and the one thing they stressed about the Akron area was the ability of the leaders and the community to collaborate together. No hidden agendas, just do what needs to be done to advance all of the goodness of this community.
Well, when we pitched this idea to the Knight Foundation, 20 of our community leaders got on planes, flew down to Miami, and together made a presentation. Dr. Proenza from the University of Akron did a wonderful job of orchestrating that for us. Tony Alexander from First Energy was there. The mayor was there. The county executive was there. All the leaders of the partner organizations I mentioned were there. And we overwhelmed the Knight Foundation. I think we outnumbered them, too.
Well,
no, I will tell you that this was one of the things that really attracted me.
okay.
To see this commitment from the public sector. The mayor, the county executive was there. The business community, as Bill mentioned, the leaders of the institutions, the hospitals, the 2 universities, all getting on a plane and flying to Miami with a common vision. When I was invited to take a look at this and to discuss whether this was an opportunity for me to contribute to this vision, I was literally blown away by what I heard and what I saw when I came.
Let's get into some basics. Okay, as I understand it, there are 5 centers in ABIA. Okay, so I want to throw out the 5 centers and have maybe a brief description of each. Okay, I understand that you have a Center for Biomaterials and Medicine. What does that do, Dr. Holder?
The Center for Biomaterials and Medicine is really our basic science arm, and that, as Mr. Considine mentioned, that's really where our polymer strength comes from. So when it comes to polymers, there's not many places on the planet that top Akron. So we have to have that as part of our institute.
Now you have what's called the Center for the Medical Device Development Center. What does that do?
Well, the Medical Device Center is the center that interacts with the physicians, brings the physicians, the surgeons, the engineers, the scientists together. They discuss patient problems, generate ideas to solve those problems, and very importantly, they not only develop designs and drawings about how to solve the problem, they make prototypes. So their end product is a prototype solution that the inventor can hold in his or her hand and really see what is it they're trying to do, and then move it forward and to do the additional tests to determine whether it can become a product.
We go to medical school to learn how to take care of patients, but we come up with all kinds of problems during the course of our practice, and we're pretty smart. And we come up with ideas, but we don't know how to move them forward. So having the Medical Device Development Center, the MDDC, in place allows me to take an idea from a sketch on a napkin all the way to prototype.
prototype.
And when we have the prototype, it's so much easier to present it to people who may find use in either its further development or its ultimate commercialization.
You have the Center for Clinical Trials and Product Development. So that then is the next step. You've got the prototype, and then you put the prototype into production.
Yeah, correct. And one of the things that is really very important also for our patients is to have the capability here to do clinical trials. We have many of our physicians, and I must add, ABIA does not do the clinical trials. These are all done in our hospitals with our hospital specialists. But we help to design protocols. We help to bring companies such as Lilly, GlaxoSmithKline, Novartis, to bring some of their clinical trials to the area. And when we have a prototype which needs further development, we have the regulatory expertise to really help the teams understand what studies need to be done so that you could ultimately get FDA approval for such a product.
And get it in the market and help
to get
people.
it into market. That's correct.
Well, I want to let our viewers know that we are going to continue our discussion about the two other centers at the ABIA Institute. And I'm also going to ask my three guests to give us a little bit better idea about the roles that they in fact play. That will be on NewsNite.net.
For more NewsNite content, including extended discussions, full interviews, and the chance to speak your mind about the issues, join us online at NewsNite.net.
And we are back to continue our discussion about ABIA and the exciting things that are going on there. And I do want to urge you to go to newsnight.net because in the extended discussion, all three of my guests gave a pretty good description of what they do, and it's most insightful. But what I would like to do now is to have you, Dr. Holder, give us a walkthrough of the brand new $13.3 million facility that's right here on Main Street and has become the headquarters for ABIA. Tell us what's in that building, please.
Oh, certainly. I've lived this building for the last 3 years of my life, from the original design of the simulation center to helping with the construction, all the way to the grand opening and its operation. So,
and remember, tell our viewers what it used to be.
Oh, it had several lives. It's actually a building that was originally constructed in the early 1900s. So it's had a life as a trolley station and trolley barn. It was the Ohio Edison building with Ready Kilowatt on the side of the building. It was the site for the Summit County Job and Family Services Department, as well as the Port Authority, now Development Finance Authority. So it's had several lives, and it's being reborn again as the headquarters for ABIA, most of which, about 75% of which, is the Simulation Center. So let me take you through that space. The Simulation Center is actually 3 floors. There is a basement floor, the main floor, which is on street level, and then finally the second floor. So let's start with my favorite spot, which is the basement. This is where we have our BioSkills Lab. And the BioSkills Lab is a place for medical device development companies, industry, as well as practicing healthcare providers to develop surgical skills. And they can do that in this space that's state-of-the-art. We have just about any video system can be accommodated in that space, as well as imaging systems. We can do minimally invasive surgery training as well as robotic training in that space with cadavers or task trainers, or really any combination of those two things. This space is connected, so we can broadcast live surgical feeds from our partner institutions or from institutions outside our partnership into that space to help the healthcare providers who are learners perfect their skills. On the first floor, the main floor, that is where our mock hospital is situated. We have a 120-seat auditorium that is, again, state-of-the-art, fully video conference enabled. We have a mock hospital that contains a functioning decontamination space, a functioning emergency medicine space. I'm kind of partial to that space.
You're an emergency
medicine physician, yes. Yeah. So we have an intensive care unit space. an obstetrics and perinatal space, because that's a very high risk in medicine, the delivery of newborns and the care of newly delivered mothers. We also have a medical and surgical ward type space, along with a functioning operating room. And all of these things are fully functional. All of the equipment works there, the electrical sockets work there, the air delivery and oxygen delivery spaces work there. So in a pinch, if we ever needed to be a surge facility for the region, we could do that.
We could do it.
Absolutely, absolutely. Mm-hmm. And finally, we have our second floor, which is the third space I wanted to talk about. That's a space where we have our standardized patient space, as well as our prototype lab. Mm-hmm. In our standardized patient space, we have 8 rooms, 2 of which can be combined into a central room for emergency medicine providers, EMS providers, and that space was really made possible by a very generous grant by the Akron Community Foundation. Mm-hmm. We can also teach bedside manner and communication skills in that space, and as we know, communication is the #1 reason for medical errors. So if we can simply stamp out communication errors, we can actually decrease medical errors substantially. Finally, our product development lab. This is where we take our ideas that were on a napkin to an actual functional prototype. Mm-hmm. And from there, they can be deployed throughout this space. So whether it's in the bioskills lab in the basement or the mock hospital on the first floor, we can see how people actually interact with that prototype device before we bring it to the next stage of development and hopefully, ultimately, commercialization.
There are a couple of other spaces that are not in that building that we need to make you aware of. One is our Akron Functional Materials Center, which is a collaboration with the College of Polymer Science and Engineering and ABIA. And that is over in the National Polymer Innovation Center on the campus of the University of Akron. And that's a space where we bring together our scientists and scientists from industry. We have about 17 companies working together in an open collaboration format in order to come up with novel biomaterials and novel polymers that can be used in devices. And an additional space just behind in our headquarters is our machine shop. And in that machine shop, we actually have a specialized instrument 5-axis, which can take the plastic prototypes we make, and that can make metal prototypes, which is one step further down in the prototyping.
Okay, so I hear about these prototypes and these things. Give me some example. Give our viewers some example of what actual products maybe you have either developed or are on the cusp of developing, or that can really help people in medical need.
I'll try one.
Yes, why don't you?
The non-physician will discuss the physician device. One of our orthopods at Children's Hospital, working with a Synergy group, came up with an idea in terms of how to deal with scoliosis. The operative procedure now is you put a rod in the back, you screw the rod in. As the child grows, you have to open the back again surgically, unloosen the screws, extend the rod. And a child that's growing could have 5, 6, 7 surgical operations where he had to open the back in order to extend the rod. Mm-hmm. Through a Synergy seminar, someone said, boy, if we only could use magnets and use magnetic devices for the screws, maybe you wouldn't have to open the back. So Apto Orthopedics is a company that's developing a medical device that puts a rod in the back and attaches these screws that are magnetic to that rod. And when the child grows and the rod needs to get extended from the outside with a magnetic device, you unloosen the screws, extend the rod, and then tighten the screws and not have to open the back surgically. That makes a difference. That's a changing technology that is transformational. We're excited about it.
You should be, absolutely. But there's wound care too. Aren't the polymers being used to develop new wound care devices?
Yes, that's so. I would like to, before we go to wound care, because this is an important disease in which there are often a lot of wounds ultimately. It's a story I like to tell because this is something which came from the community. A grandfather concerned about his 8-year-old who has type 1 diabetes, mm-hmm. and the anxiety she has in delivering her insulin, had been puzzling. Is there a way to distract her so that she doesn't worry about the pain, but at the same time faithfully give the insulin? He had some ideas which he had drawn on his napkin, and he went over to Children's with his idea, and they came to ABIA, and together we worked on it, and after about 9 months we produced a prototype which we call VibraEase, which actually we're presently discussing licensing to a company. But there we developed a prototype which vibrates actually as she puts it on, say, her leg, and she can deliver the insulin, and it distracts.
It distracts her.
I was not there when this happened, but I was told the story that when this grandfather saw the prototype of his idea, tears welled up.
Oh, of course.
And this is the type of power of this collaboration, that the community is involved, and the community can come to our hospitals, or hospitals can come to ABIA, and as partners we can work together to provide solutions.
We have two additional prototypes, actually. One is what we call a transvenous pacemaker trainer. It's called PacerMan, and it's in its final stages of its licensing agreement. This device is actually used to teach healthcare providers how to perform transvenous pacing. That's a procedure by which you help the heart with its rhythm when the heart has been injured, typically after a heart attack. Okay. In the past, we learned this procedure sacrificing animals, or we learned it in real time on patients, which is unacceptable. Unacceptable. And in the past, that's how we've always been taught. But simulation as a technique, as a teaching tool, allows us to develop these tools safely. And so we end up developing these experts, or if you're drawing an analogy to a flight simulator, you're developing aces. Okay, and who would you rather have working on you?
Someone the ace who's practicing the simulator.
You want the ace.
Absolutely.
So PacerMan allows healthcare providers to practice the technique using the same devices they would use on actual patients. And it gives you all the same cues, all the same feedback, and you can practice as many times as you need to. The other device is what we call NeuroSim. NeuroSim is a stroke simulator. Many Americans, many people in our community, many people throughout the world are affected by cardiovascular disease and stroke. And one of the best things you can do is to determine if someone is having a stroke right then and there. Sure. And the people that see the most contact with these patients are our emergency medicine technicians. And so we've developed a device that can accurately reproduce the signs and symptoms of a stroke, and you can interact with it either by voice, by physical touch, or with a computer and mouse.
So the ramifications of what's going on at ABIA are going to impact lives around the world. We only have like 5 minutes left, and I've got a couple of quick questions here. Sure. How is it going to develop the local economy? Because I keep hearing about, there is going to be a way that the local economy is going to benefit. Bill?
Well, one of our metrics that we laid out early on was around new companies and new jobs. We also wanted to make sure that we were working very closely with the mayor and the county executive relative to the biomedical corridor. We've been involved in conversations now as we're building relationship over in Israel through Target Tech and a couple of incubators over there, Slovenia, Finland. As the mayor and others have reached out, we avail ABIA resource to them. In fact, at Children's Hospital, we now have 2 memorandums of understanding with 2 universities in Israel, where we are the clinical trial site for them. I believe that's already impacting what we're doing here in this community relative to jobs. Physicians that the hospitals are recruiting now are having more of an interest in the scientific side, too, of medicine, not only the clinical side, but the science of medicine, which is very key to medical device development and the like. So this is all about bringing jobs to our community, bringing vitality to this community through, again, innovation and bringing people together to work on new and creative ways to be better at what we do.
quickly, in less than a minute, can you tell me how you are funded? I mean, at one point, I think, Dr. Douglas, you said grants, and the Knight Center, obviously, as a founding partner. Will the development of some of these products, will it benefit the ABIA in the long run?
Yes, we're funded, as you know, by a grant from the Knight Foundation. The 5 partners each committed to 5 years of funding. First Energy also gave, in fact, the initial $10 million to get this started was committed by First Energy. We spend a lot of time getting grants. However, as we move forward and as we generate revenues from these devices, as well as some of the programs that we can deploy in the community for community health, we will be sharing those revenues with our partners, and those shares that come to ABIA would help to continue to fuel the growth and activity of ABIA.
We've got a minute left, and I want each of you to give me a short, sweet answer. Project down the road, 5 to 10 years. Where do you see ABIA and the Akron community in 5 or 10 years? Dr. Douglas?
In 5 or 10 years, my vision is that anywhere in the world, if someone would like to find a place where they would like to develop a biomaterial-based device, Akron must be the first place they think of.
Yes.
5 years from now, 10 years from now, if they want to find a place where a collaborative effort around institutions can improve the health of a community, Akron must be that example they think of.
Dr. Holder?
I would love to see us in 5 to 10 years be the name of healthcare education. When we have providers that come through our programs, whether they be from NeoMed or the University of Akron, or trained in one of our founding partner hospitals, or even our regional partners, I would love for people who trained here to be trained with our method and simulation and then be deployed throughout the country, and the name of Akron.
Go with it.
Go with it.
Bill, you've got 5 seconds.
National distinction. We wanted to be nationally known for collaboration, for touching the lives of the families we're all privileged to serve, and to be recognized as the best.
Thank you, gentlemen. It was a most enlightening program, and no wonder it is recognized right now as one of the best because of the 3 of you. So thank you very much. Good luck to you. I'll look forward to maybe having you back in 5 or 10 years. And thank you for joining us on NewsNite. Good night.